Vaginal and cervical concerns. What is the vaginal cervical? The vaginal cervical is the lower narrow end of the uterus that forms a canal between the uterus and vagina. So, sa oras ng ovulation, ang cervical mucus ay manipis at puno ng tubig at madaling mapasok ng spermatozoa sa loob ng 12 hanggang 72 hours. Kung ang pakikipagtalik ay hindi nakasabay sa oras na ito, ang cervical mucus ay maaaring payagan ng spermatozoa na tumago sa cervix. Ang infection or pamamaga ng cervix erosion ay maaari ding maging sanhi ng pagkapal ng cervical mucus, kaya hindi ito madaling mapasok ng spermatozoa o makaligtas dito.
As denotic, cervical OS or obstruction of the OS is a narrowing of the canal or passageway of the cervix. Causes of cervical stenosis. Cervical stenosis may be present at birth or may be caused by other factors such as surgical procedures performed at cervix like cone biopsy and cryosurgery, radiation therapy, trauma to the cervix, repeated vaginal infection, cervical cancer, and menopause. Testing and therapy for vaginal and cervical concerns. If sperm do not appear to survive in vaginal secretions because secretions are too scant or tenacious, a woman may be prescribed low dose of estrogen therapy to increase mucus production during 5 to 10 days of her cycle. Kapag ang vaginal discharge ng isang babae ay kaunti lang ang lumalabas pagdating ng kanyang menstruation, pwede tayong mag-prescribe ng low estrogen pills. These estrogen pills helps to improve sperm or egg cell count, to aid in fertility in women, ovarian cysts, myoma, and PCOS.
Ang conjugated estrogen primarin ay isang uri ng estrogen na inireseta para sa layuning ito. Kung mayroong infection sa vaginal, ang infection ay gagamutin ayon sa sanhi ng organism batay sa mga ulat sa culture. Ang mga infection sa vaginal tulad ng trichomoniasis at moniliasis ay madalas na umuulit na nangangailangan ng malapit na pangangasiwa at pagsubaybay. Kung ang sexual partner ng babae ang pinagmumulan ng infection at sa makatuwid ay muling nahawaan siya, ang partner ay nangangailangan din ng antibiotic therapy. Mag-ingat ang mga kababaihan na niresetahan ng metronidazole para sa infection sa trichomonas. Maaring ito ay teratogenic sa unang bahagi ng pagbubuntis at sa makatuwid ay hindi dapat ipagpatuloy kung ang babae ay naghihinala na siya ay nabuntis.
Unexplained subfertility. In a small percentage of couple, no known cause for subfertility can be discovered. It may be that problem as one partner alone is not significant, but when combined with a small problem in other partner, together this becomes subfertility. Genes are 70% of unexplained infertility cases. These are premature ovarian failure or depletion, the inability of the sperm to penetrate the egg, immunology factors or the male sperms, and a complication from past miscarriages or abortion. It is obviously discouraging for couples to complete a fertility evaluation and be told their inability to conceive cannot be explained. Offer a support to help the couple find alternative solution at this point, such as continuing to conceive, like make an appointment with your OB/GYN, maybe begin a basic fertility testing, graduate to a fertility clinic, begin fertility treatment plans, and reevaluate plans if when unsuccessful. You could also use assisted reproductive technique like artificial insemination, in vitro fertilization, and surrogacy. Couples could also choose to adopt or agreeing to a child-free life.
Assisted reproductive techniques. If ovulation, sperm production, or sperm mobility problems cannot be corrected, assisted reproductive strategies are the next step for a couple to consider. Bago simulan ang procedure, ang babae ay dapat discontinue ang smoking or ang kahit anong recreational drug behaviors, at dapat sila ay nag-i-ingest ng diet na high in protein, at dapat sila ay may BMI within a normal range of 18.5 to 24.9. Nakapag-undergo ng test, kailangan niyang mag-undergo ng test for HIV and hepatitis C. A hormone profile including levels of FSH, LH, estrogen, and progesterone to test for ovarian reserves, as well as intravaginal sonogram to visual structures. Obtaining a sexual history is often difficult because cultural taboos can make couples feel uncomfortable discussing this part of their life. Simple factors such as how often couples engage in sexual relations or kung gaano kadalas magkaroon ng sexual activity or sexual engagement ang mga couple. For example, they are influenced by culture and religion. According to Orthodox Jewish law, a couple may not engage in sexual relations for 7 days following menstruation or the nida period. This practice can result in infertility problems if a woman ovulates within the 7 day period. Some cultures forbid alternative insemination because preserving male lineage is so important. The Roman Catholic Church does not approve of in vitro fertilization or any form of conception outside the body. So, ang Roman Catholics daw ay hindi approve sa vitro fertilization or kahit anong conception outside the body. Being aware of cultural differences can help you understand the different ways couples react to a diagnosis of subfertility and help you appreciate the full meaning of this diagnosis to an individual couple.
Alternative insemination. Alternative or intrauterine insemination is the instillation of sperm from a masturbatory sample into the female reproductive tract by means of cannula to aid conception of the time of ovulation. The sperm can either be instilled into the cervix, intracervical insemination, or directly into the uterus at the time of predate ovulation. Intrauterine insemination or mas kilala sa tawag na IUI. Ang intrauterine insemination ay procedure na ginagawa kung saan pinapasok sa ari ng babae ang sperm gamit na tools. Dito ay tinatawag na speculum. Tapos pinapasok ito naman sa vagina ng babae para makita ang cervix. Ang syringe o ang speculum ay naglalaman ng sperm, tapos ang syringe naman na ito ay naka-attach siya sa tube na tinatawag na catheter. And this catheter guided papunta sa uterus. Then, if nasa inside na ang catheter, the doctor inject the sperm it. Then, if matapos ang procedure na kinakailangan ng babae na humiga muna at least for 10 minutes. The best day of time na gawin ang procedure na ito is during the monthly menstruation of a woman, dahil ang ating ovary ay nagre-release ng egg na tinatawag na ovulation. After the ovulation, the egg enter the fallopian tube that the woman are mostly get pregnant. Either the male partner sperm, alternative insemination by male partner, or donor sperm. Alternative insemination by donor can be used. Ang pag-undergo ng intrauterine insemination is pwedeng gamitin ang sperm ng mismo mong partner or from the donor sperm as long as na walang genetic disorder ang may-ari ng sperm. Sperm can be cryopreserved frozen in a sperm bank before radiation or chemotherapy and then used for alternative insemination afterward. One disadvantage of using cryopreserved sperm is that it tends to the slower motility than unfrozen specimen. However, although the rate of conception may be lower from this source, this treatment is beneficial for, number 1, couple with fertility issue. Sa mga couple na may problema sa pagpaparami, couple who find it difficult to have vaginal intercourse,
Couples with medical issues who need assistance to conceive. If either partner has HIV, if the female partner has semen allergy, female partners who have suffered from cervical scarring, and male partners who suffers from ejaculation or erection problems.
In vitro fertilization, also known as the IVF is a medical procedure whereby an egg is fertilized by sperm in a test tube or elsewhere outside the body. IVF is a type of assisted reproductive technology used for infertility treatment and gestational surrogacy. A fertilized egg from a donor may implant into a surrogate's uterus and the resulting child is genetically unrelated to a surrogate. Ang procedure na ito is para sa mag-asawang hindi kayang magkaanak due to damaged fallopian tube or yung babae is masyado ng matanda and yung lalaki is low yung sperm count niya. IVF is a process of fertilization where an egg is combined with sperm in vitro. This process involves monitoring and stimulating a woman's ovulatory process, removing an ovum or ova from her ovaries, and letting sperm fertilize them in a culture medium in a laboratory. How does the IVF works? Mature eggs are collected from ovaries and fertilized by sperm in a lab. Then, the fertilized egg, which is the embryo, are transferred to a uterus. One full cycle of IVF takes about 3 weeks. Sometimes these steps are split into different parts and the process can take longer. These are the advantages of IVF. For couples who can't conceive, unlike IUI and other forms of assisted reproductive technologies, IVF can be more successful. It can benefit same-sex couple and single women. Embryos that aren't used can be given to research or another couple. IVF can be used to diagnose issues with fertilization. It is possible to check embryos for any inherited illnesses. Disadvantages. A failed IVF cycle is possible. There could be side effects and risks. There is a chance of multiple pregnancy. There is a slightly increased risk of ectopic pregnancy. High estrogen levels associated with high stimulation IVF have been linked to an increased risk of prematurity and low birth weight in babies. It can be emotionally and psychologically draining, and it can also be expensive. Some patients might be concerned about ethical issues.
In some centers, nurses practitioners are the healthcare providers who complete all site removal and transfer. All nurses have responsibility to supply, support, counseling, and help sustain a couple through the process. The recovery harvesting ripened egg is high about 90%. However, the overall pregnancy rate in IVF is as low as 30 to 35% per cycle for women under 35 years old and 6 to 10% for women aged 40 years old. IVF is very expensive, about $10,000 per cycle, and is available only at specialized centers. When the pregnancy is success and the couple's report of feeling social isolation during his time and weariness answering friends and family questions about they will have a baby, supply empathic support for them through this difficult time.